Still ahead, we've heard the warnings about the effects of pop on your teeth, but what about other drinks? What about even sparkling water? We'll hear what a dentist has to say when we return. In an effort to cut down on the amount of pop or soda people are drinking, many today are turning to sparkling water. In fact, sales of carbonated water have more than doubled in just the past 5 years. However, a lot of folks are wondering, is it really better for our children? Joining me right now is Dr. Vicki Ursitti, a pediatric dentist, to talk more about the potential dangers during this National Children's Dental Health Month. That's a mouthful.
That sure was.
Doctor, good to see you. Thanks for coming in.
Thank you, and thanks for having me.
So let's talk about various beverages and what they can do for you. What do we know about sparkling water and what sort of effect it might be having on our teeth?
Okay. Well, you know, Corey, it's true that there's increased sales. People are looking for healthier options, but there really is no hard evidence saying that sparkling water is very damaging for your teeth.
Okay.
You know, it's a water that's infused by carbon dioxide, so it has a byproduct of carbonic acid, but that's a weak acid. So the thing is, if it has some sugar in it or citric acid, it raises the level of acidity, and that's a lot more concerning because we do know that acid does wear on teeth. And if you're constantly sipping it all day long, you're just bathing the teeth with acid. My best advice is to turn to plain water for children. In fact, in my practice, I tell the kids, drink milk because it makes you strong, and water because it makes you pretty, and of course for the boys, handsome. So they kind of they latch on to that.
Yeah.
It works. But if you do have to have those beverages that you like very much, have it with a meal. When you're eating, it produces saliva. Saliva is the natural buffering mechanism that neutralizes the acid.
Okay.
So there you go.
But obviously there are worse things to drink probably than sparkling water. What are the biggest ones you want to typically get your kids to stay away from as much as possible?
Well, again, the overly sweetened beverages are just horrible. And it's not it's not just the beverages themselves, it's the matter of times you're having them, the frequency of times that you're having them that really hurts the teeth.
Right. Someone just earlier told me, boy, I hear that sports drinks are just the absolute worst for your teeth. Do you go along with that? One of the worst things you could do?
Yes,
yeah.
I'll champion that notion. I don't like them. Citric acid, so many artificial things in there. Besides your teeth, it's just not healthy for your body. But speaking of teeth, not good.
So what's going on today, you know, with fluoride in our water, the availability of dental care products? Why are kids still having cavities?
Oh my God, that's the million-dollar question. And unfortunately, it probably has to do with some of the sweetened beverages.
Okay.
And then, you know, people just don't always have the education or the access to get to the dentist. Let me add this, that February is Children's Dental Health Month.
Right.
And as a pediatric dentist, it just thrills me. This is my favorite time of the year because dentists around the country are going out raising awareness to tell the importance of good oral health. In fact, the Chicago Dental Society, of which I'm a very proud member of, distributes free supplies of toothbrushes, toothpaste, educational brochures to over 300 schools in the Chicago area.
That's fantastic.
It
now,
is.
If someone wants to get a hold of some of those materials, and how would they do that? Do you know who would they contact?
Yeah, of course.
Yeah.
They can go onto the Chicago Dental Society website at cds.org.
All right, very good. And the Chicago Dental Society is also taking part in one of the largest conventions in town coming up too, right?
So you've heard, yes. Very soon we're holding a Midwinter Meeting down at McCormick Place, February 25th through the 27th. And it's a phenomenal meeting because the purpose of the Chicago Dental Society is to advocate for excellent oral health. That's our purpose. I mean, we get together as colleagues, but in this meeting they have courses and world-renowned speakers, so I could take this information back and bring it to my patients.
Fantastic. Well, thanks for bringing us some insights into what we should or shouldn't be doing with our kids and various beverages. We appreciate you coming in.
My pleasure.
All right.
Nice to speak with you.